Uh, Good evening. Oh, goodness. Good evening, everybody. This is Ann Lamaster. Tonight we're talking about Chapter 23, which is Pregnancy, Growth, and Development. So we're talking about what happens after reproduction. So once you have formed a zygote from the sperm and the second oocyte joining, then you get prenatal development. And prenatal development is roughly 38 weeks, and it's cell division, growth, and specialization into tissues. So you'll see your 4 tissue types. These will form organs, and then you'll get a new human being. It should all go well. Now we're going to talk about the difference between growth and development. Growth is an increase in size, whereas development, it does include growth, but it's the continuous process by which an individual changes from one life phase to another. So we're talking about going from toddler to child to teenager, things like that. We have 2 main periods. Prenatal period is fertilization to birth, and that's what we're going to be talking about primarily today. And then postnatal period is from birth to death, and we've kind of covered that in both semesters of A&P, if you will. All right, conception. And then conception is when the secondary oocyte and sperm meet, and it takes place in the uterine tube. Now, only a few hundred of the 2 to 600 million sperm reach a secondary oocyte. So remember, the egg is released into the uterine tube, and the sperm have to swim up through the vagina, which is slightly acidic, and into the uterus, and then half will go one way and half will go the other. And there's all sorts of mucus and the female's cells, her immune system interfering. But a few hundred lucky sperm should make it to meet the egg or the secondary oocyte in the uterine tube. All right, let me get my pointer or my spotlight here. Okay, now the reason why you need so many sperm, and we're looking at this diagram here, the sperm on their tip have something called acrosomes. And let's go to this diagram. This is an enzyme containing unit, I guess for a better word. And basically it's there to get through the corona radiata and the zona pellucida. Okay, so it's to get to the nuclear material of the secondary oocyte. And remember, only one sperm enters, and then the secondary oocyte undergoes meiosis too. And then you have a tiny polar body, which is reabsorbed by the female. And then you have an egg nucleus. And then the egg nucleus and the sperm nucleus unite, forming a zygote. All right. The technical term for pregnancy is the presence of a developing offspring in the uterus. And remember, from fertilization to pregnancy, there's a 7 or 8 day window, because it takes 7 or 8 days for the fertilized egg to reach the uterus. Once implanted in the uterus, pregnancy consists of 3 trimesters, about 3 months long, or 38 weeks. You have the period of cleavage, which is another term for cell division. You have the embryonic stage, and finally you have the fetal stage. The period of cleavage is just rapid cell division. And the cells produced are called blastomeres. So the rapidly dividing cells seen here are called blastomeres. All right, in cleavage, or periods of cleavage, The zygote is the fertilized egg, okay? And this is what's showing you here, because again, fertilization occurs in the uterine tube. Then from zygote, you go into the morula or morula. Morula is referring to the dividing cells, a solid ball. And then the cells continue dividing and form a hollow ball, and that's called a blastocyst. And it's this hollow ball that about 7 or 8 days after fertilization will implant in the endometrium of the woman's uterus. There's 2 layers of cells in the blastocyst. You have the inner mass, which is shown in blue, and this is going to give rise to the embryo. Then you have the trophoblast, which is kind of beigey. This is going to help, along with the uterine wall, produce things like the placenta and just nurturing structures, or structures that will aid the embryo during development. For example, the placenta. Okay. Of course, pregnancy involves hormones. Human chorionic gonadotropin hormone. This is what most early pregnancy tests or home pregnancy tests detect. It's there to maintain the corpus luteum. The corpus luteum is the tissue that's left in the ovary after ovulation. It's going to inhibit FSH and LH, so it's going to prevent further egg development or new egg development in the ovary. The corpus luteum is going to secrete estrogens and progesterone. Progesterone is especially important for the embryo's development. Estrogen and progesterone stimulate and maintain the uterine lining. Again, inhibit the gonadotropins. Inhibit uterine contractions, so the blastocyst can firmly implant, and they will enlarge reproductive organs. Another hormone released is called relaxin. It too is going to inhibit uterine contractions and relaxes pelvic ligaments. Placental lactogen stimulates breast development in the mother. Aldosterone promotes sodium retention because you're going to need more water because more fluids. And parathyroid hormone is also going to maintain calcium concentrations in the blood. Other changes during pregnancy include the uterus can displace abdominal organs and disrupt meals, so eating could become uncomfortable because of heartburn. Also, because the uterus is right on top of the bladder, you could have increased urinary frequency. You're also going to need more. You're going to need more oxygen. More waste is secreted, produced and secreted. Increases in blood volume, cardiac output, breathing, urine production. And of course, you need adequate nutrition, and you need to increase your vitamin, mineral, and other nutrient uptake. All right, the embryonic stage. That's the 2nd week through the 8th week. This is when the placenta forms. Here, okay, we have these 3 germ layers. This is what's going to form the embryo here. And then these structures here are going to form the placenta and umbilical cord. So let's talk about that a little more. You have the chorion. That's going to increase nutrient exchange between the mother and the embryo. The amnion, which is also in red. The amnion is going to provide space for the amniotic fluid. The yolk sac will contain stem cells. The placenta will attach to the fetus and uterine wall, and the placenta is going to develop in this area here. And the umbilical cord, which is going to develop in this area, is going to connect the fetus to the placenta. And by the end of the second week, the primary or primordial embryo, oh my goodness, I'm sorry, I can't speak this evening. The primordial embryo has formed 3 germ layers. And the 3 germ layers are the 3 embryonic tissue types, and it's called a gastrula. Let me go back and show you the 3 previous germ layers, and those are right here. The ectoderm, mesoderm, and endoderm. These are the 3 germ layers that will give rise to all tissues. All right. As the amnion develops, it surrounds the embryo. So amnion, or a fluid-filled cavity. The umbilical cord tends to form. And then this area here is going to start to form the placenta. Remember, the placenta is part of the embryo, and it's also part of the mother. It contains both cell types. This little chart here shows you when structures develop during pregnancy. Now, let me get this one. The reproductive system begins as early as 1 month. The ears, eyes, and limbs begin before 1 month or before week 4. Heart begins even earlier. And the central nervous system, its development begins early and continues onward. Here we have teratogens. These are anything that can disrupt development, so then cause mutation. And these are when, for example, thalidomide, this are when this teratogen can develop or disrupt the most development. All right, at the end of the 8th week, we now have the fetal stage. Growth is rapid, body portions change, head is large, lower limbs are short. Between the 9th and 12th week, the size is approximately 10 centimeters and weighs 1 ounce. Through the 13th through the 16th week, gains about 5 ounces. Notice ossification continues. Through the 17th through the 20th week, we get muscle movement and start to feel the mother starts to feel the fluttering. And we go up to 1 pound, and the size is 12 inches. And then the 21st through the 38th week, we could get up to 21 inches, maybe longer, and the baby grows anywhere to 6 to 10 pounds. Now, because the lungs and the heart and liver are developing in the fetus, however, they don't have the same functions because the mother is providing all the nutrients and oxygen. The fetal circulation is a little different. For example, the fetal blood, the hemoglobin will carry more oxygen. You have the umbilical vein, and that carries the nutrient-rich, oxygen-rich blood from the placenta to the fetus. The ductus venosus, this kind of bypasses the liver. Foramen ovale, these bypass the atria and the lungs. The ductus arteriosus, it also connects the blood from the pulmonary trunk to the aorta, so this too bypasses the lungs, because again, the lungs aren't needed to oxygenate the blood. And then we have the umbilical arteries that are going to carry away carbon dioxide and waste. All right, after 38 weeks, the pregnancy is going to terminate with the birth process, and then the fun begins, labor. What happens during labor? Progesterones decline, so now uterine contractions will increase. You'll have more prostaglandin, release, which is going to initiate labor. The stretching of the uterine tissues is going to release oxytocin. This is going to be a positive feedback loop and cause increase in uterine contractions, which is going to aid contraction, or, well, aid the birth of the child. The fetal head will stretch the cervix. Again, positive feedback, causing stronger uterine contractions and more oxytocin. And again, more positive feedback until the fetus is forced through the birth canal to the outside. A process that takes a while. So here we go. The beginning of labor, positive feedback here, causing the cervix to dilate. Then we have the birth process. And then even after you've given birth to your beautiful 7, 8, 9, 10-pound miracle, they want you to push some more to get rid of the placenta because they can't pull it out via the umbilical cord. I asked. Other changes that occur in a woman's body during birth, the breast change, of course, because the breast contain the mammary glands, which are there to nourish the baby. Prolactin is going to be released by the anterior pituitary, however, milk secretion doesn't begin until after birth. The first secretions from the breast are called colostrum. They have lots of proteins and antibodies, so this is an example of passive immunity. Not a lot of carbohydrates and fats, and then mature milk comes in a few days later. Again, breastfeeding is another positive feedback loop. Once the nipple or areola around the nipple is stimulated, the hypothalamus signals the release of oxytocin from the posterior pituitary gland. And oxytocins cause the alveolar glands to contract, which ejects milk through the nipple. Now the postnatal period. Lots of things occur for both the mother and the newborn. And again, the postnatal period is divided into several sections. You have the neonatal period, which is birth to the end of the 4th week. Infancy is 4th week to 1 year. Childhood is 1 year to puberty. Adolescence begins at puberty and goes into adulthood. Adulthood to old age, and then old age to death is senescence. Senescence. Again, I'm sorry, I am not talking very well today. There are multiple types of aging. You can have active aging, which is not exactly good. You can have things like apoptosis, programmed cell death, or autoimmunity. Passive is a breakdown of structures and slowing of functions, which does occur. I'll let you read those. The human lifespan can be up to 120 years. In the United States, it is 75 years for men and about 83 years for women. And of course, lots of factors figure into that. And I believe, okay, this is the last slide of the lecture. What this occurs is in 2007, the leading causes of death. Heart disease, this is both in men and women. Cancers, stroke, COPD, accidents, Alzheimer's, diabetes, influenza, kidney disease, and septicemia, which is a blood infection. So I believe this is the end of the presentation. Well, thank you all, and good night.